Hello, everyone, and welcome. Thank you for joining us for today's presentation, Companionship, the Missing Ingredient in Senior Nutrition, presented by Home Instead and hosted by the American Society on Aging. My name is Victoria Ruiz, and we are so glad you're here. We will begin shortly, but before we do, a few housekeeping notes. The slides for today's presentation are available under the tab on your screen labeled Resources. And under the tab labeled CE Application here, you will find information on how to obtain CE credits for this event. You will also receive a follow-up email by the end of the business day that will direct you on how to claim CEUs, including links to today's slides and recording. You have 60 days to complete a continuing education application, and it may take up to 30 days from the date of the live event to process and issue your CE credit. If you are not logged into the webinar directly using an individualized confirmation URL, then you will not be eligible for CE credit as we have no way of tracking your online attendance. To be eligible for CE credit, you must register using your own email address and then use that individualized link. If you have any questions during today's presentation, you can send those to us at any time using the questions box, and we will save the last 10 to 15 minutes of today's programming to get to those questions. And now I would like to welcome our presenter, Dr. Lakelyn Eichenberger. Dr. Eichenberger serves as gerontologist and caregiving advocate at the global headquarters of Home Instead. Lakelyn began her career at the local Home Instead franchise in Omaha, working one-on-one with seniors and care professionals. Today, at the global headquarters, Lakelyn works to educate professionals in aging, families, and communities on the unique challenges older adults face and the resources available to help them thrive. Lakelyn earned a PhD in gerontology from the University of Nebraska, Omaha. She has spoken at national and international conferences on the topic of caregiving and aging and serves as a resource to major media, including Dr. Phil and Dr. Oz. She also values giving back to her community, currently serving as a board member of the National Alliance for Caregiving, board chair for the Dreamweaver Foundation, and member of the Alzheimer's Association's Dementia Care Provider Roundtable. Lakelyn has a passion for helping others, especially aging adults and their families. We are so excited to have you here with us today, Lakelyn.
Thank you so much, Victoria. Hello, everyone. Welcome to today's webinar. I cannot believe it's December already. Each year, I love this webinar series, and I'm always just amazed at how quickly the year goes by. I'm already busy working with Victoria on our schedule for next year. We're going to skip the month of January and pick back up in February with the ethics of aging. So I hope you'll join us for all of next year's great web seminars as well. But so glad you're with us today. We're talking about companionship, which is often the missing ingredient in senior nutrition. I know that when we talk about nutrition, the importance of it really cannot be understated when we're talking about the older population. But for some older adults, it can be challenging to get motivated to cook nutritious meals, especially for those that live alone. And actually, if we look at the Census Bureau data, about 28% of older adults that are community dwelling live alone. So that could put them at risk for things like poor nutrition. And actually, poor nutrition or malnutrition can affect the mind, body, immune system, and energy levels in ways that older adults and family caregivers might not be aware of. So older adults who might eat their meals alone versus eating meals with others, we find that those that eat with others that have companionship at mealtime often take in more nutrients and a host of other benefits as well. So I'm really glad that you joined me for today's session, and I'll go over the objectives now quick on this next slide. So hopefully today, these are the things I want to cover. We'll talk about the warning signs of poor nutrition, identify risk factors for eating alone, and then also understand the benefits of companionship at mealtime, and then talk about some resources and some fun and creative ideas on how we can engage older adults at mealtime and spend more time with them while they eat. But I think it's important to understand, what are those warning signs of poor nutrition? That might not be, on a family caregiver's radar to look for certain signs of poor nutrition. But pardon me, if we identify these signs, we want to make sure that we address them, because oftentimes when it comes to nutrition, hopefully there are interventions, things we can do, resources that we can provide the older adult and their family to help improve their intake of nutrition. So first, a loss of appetite. As an older adult advances in age, often we see appetite dwindle, but if there's a complete loss of appetite, that is concerning. It could be due to something like an underlying illness. Maybe they have something wrong with their mouth, like ill-fitting dentures or a sore in their mouth that makes it really painful to eat. Maybe it's also a medication, a reaction to a medication, a side effect of a medication that's really causing a suppressed appetite. So there could be a lot of factors at play, but if you notice that loss of appetite, it's not something to just ignore. We need to address it. Also, changes in mood is something we can keep an eye out for. It could be a warning sign. Depression, while some people think that's a normal part of aging, it is not. And sometimes depression can cause someone to not have an appetite or not feel motivated to make a meal. So if you notice that your loved one's feeling a little more depressed, you might want to start asking them, are they eating? What have they eaten recently? And also, if you're noticing a change in mood in terms of maybe they're feeling or seeming a little flighty or spacey or maybe a little bit out of it, it could be a sign that they're not getting enough nutrition or a sign that they are dehydrated. And that's a really serious issue that we want to address in older adults. Another sign could be a fluctuation in weight. A sudden weight gain or weight loss could indicate that there's something going on with their nutrition. Maybe it's that if they have kind of like CHF, a heart condition where sodium is retained and they can, or increase in sodium makes them retain more water and they could quickly gain weight. That's an issue that needs to be addressed, of course. But maybe there's some modifications to the diet that can be made to improve the nutrition and hopefully help prevent that weight loss in that way. Or if you lost your appetite and you're not eating, you might start to lose weight. And so it could kind of be hard to spot if an older adult is losing weight, but you might want to pay attention to how their clothes are fitting. Are they making new notches in their belt? That sort of thing. And then also skin tone can be an indicator. People who are well hydrated and taking in good nutrients, they have healthy looking skin, but those that lack nutrition, elements of nutrition could have dull or ashy looking skin. And so it could be that, we need to have a conversation. What kind of things are you eating at mealtime? Do we need to increase the number of fruits and vegetables, that sort of thing? I mentioned medications could impact nutrition. It could be that, a steroid is really increasing an older adult's appetite and they feel like they just can never be full, or maybe they start a new medication and it's making them nauseous and they just don't feel like eating anything. So again, if you notice a change, especially after an introduction of a new medication, we want to take that seriously and let the medical provider know that this is happening. Maybe there's an alternate medication, or maybe they're not taking the medications as directed. And then finally, lethargy. If a person's feeling tired, lethargic, they might not be, again, motivated to make a meal, and if they're feeling lethargic, they might not also be wanting to get up and move about the house. And so, over time, that could cause their muscles to weaken, and it could cause kind of a domino effect. And so if you're noticing that your loved one is feeling a little lethargic, it could be that maybe there's something going on health-wise that needs to be addressed to give them a little more energy, or maybe it's the nutrients that they're taking in needs to be increased so that they do have the energy to continue to get that good nutrition. There's also some physical and social elements or factors to consider when it comes to our nutrition intake and what we eat. And I think they're important things for us all to consider. So when we look at physical factors, we see a growing prevalence of chronic illnesses, chronic conditions as we age in the older population. And if you think about those various chronic conditions, I mentioned CHF already, often that has some implications for nutrition, watching the salt intake. For those that have diabetes, that kind of a chronic condition, sugar intake and carbohydrate intake is really important to keep an eye on. But also think about like arthritis. If you have arthritis in your hands, it might be more challenging to prepare meals for yourself. I remember one of the clients that I worked with over the years, she had macular degeneration, so she had poor eyesight, and she was still living independently, but she had a caregiver from Home and Said come in and help with some of her meal preparation because she could not see well enough to chop vegetables. But once the meal was kind of already pre-prepared to a certain extent, then she could heat it up in the microwave or on the stove. She had some things that made cooking to a certain degree accessible in the kitchen, but she just needed a little more assistance. So when we think about chronic illnesses or chronic conditions, we could also think about how will that impact their nutrition intake. That might not be something that's on a family member's radar. Also, problems with chewing and swallowing. I mentioned earlier that there might be something going on in the mouth that's preventing them from eating. Maybe it's those ill-fitting dentures. Could be cavities or gum issues. It also could be, abilities to swallow. After perhaps a stroke or other conditions, it might be more challenging for an individual to swallow. So there might need to be thickening agents involved at the direction of a healthcare provider, dietitian. But again, you want to check in with the individual. How recently have they been to a dentist? Maybe that is a good kind of next step in maybe ruling out some of those issues or addressing those issues. And also sometimes dry mouth from medication can be a side effect that might make, eating a little bit more challenging. And sometimes we see dry mouth associated with certain medications for certain chronic conditions like Parkinson's disease. We also know that as an older adult advances in age, some have more issues or challenges with the absorption of nutrients into the body. Certain digestive enzymes and acids diminish as we age, which can make it harder for the body to break down proteins and absorb some key vitamins and minerals. And in those cases, it's good to talk with the doctor or the healthcare provider about any deficiencies of nutrients, and perhaps there's an additional supplement that needs to be added in addition to kind of their nutrition that they're taking in. And then I've already talked about medications a couple of times already, but it can also not only suppress the appetite, but for some folks it can alter the way food tastes. And so just think about it. If your food's not tasting the same any longer, then it might not be as appealing to take in nutrients, proper nutrients. And so, again, I talked about kind of also making sure that medications are taken as directed. A lot of times the directions say take with food or take on an empty stomach. And so if they're not being properly taken, it could be causing things like nausea. If it's supposed to be taken with food and they're taking it without food, that could cause nausea and prevent them from eating. So we want to be sure that they're taking those medications as directed. Also, recent hospitalizations. Nutrition comes into play here in a lot of different ways. After a hospital stay, often your body kind of goes through some stress and trauma. It could lead to some loss of appetite or feelings of weakness. After coming home from the hospital, they might be tired. They might not feel up to cooking or grocery shopping. They might also, if they've been away from the home for a long period of time, they might not have a fridge full of food or a pantry full of items to even cook meals with. So we know that, making sure that proper nutrition happens after hospitalization is so important. Also in the recovery process, because we want to be sure that they're getting the proper nutrition so that they can continue to recover, making sure that they're hydrated so that they don't get dehydrated and re-hospitalized. Some other things to consider is our taste and smell diminishes as we age. I mentioned, if you can't taste the food that you're enjoying, it takes away a little bit of that enjoyment. I know my grandpa, he over the last couple of years has really lost his sense of taste. And my grandma is an amazing cook, and he has salts everything, and it always offends her. It always kind of makes me giggle a little bit. She's always like, Larry, I seasoned that to what I thought was perfection, and here you are putting salt on it or Tabasco, and he simply just can't taste certain types of things anymore. And so for him to make it enjoyable, he has to add some extra flavoring. And for him, he doesn't have, chronic conditions that we need to consider, for fluid retention and that sort of thing. But for those that do, over-salting or over-sugaring could be an issue. So we do need to keep that in mind. And so, instead of using things like salt, maybe you get creative with the various spices that you have in your cabinet that you incorporate into the food to make it taste good or to keep things interesting. And then lower levels of activity. As we get older, some experience limitations in mobility. And so if there's less activity, it could cause a loss of muscle or fat, which could change, a person's appetite. I know after I do a workout, I'm really, really hungry. But if I haven't worked out all day or just kind of sat at my computer and worked all day, I find that I'm not as hungry. And so, again, we can also assess the activity levels and see, how does that play into all of this as well. And then there are some social factors, which, of course, companionship is one of those social factors that I'll talk about in just a moment. But really, we can't overlook these social factors. And I think it's something that people really don't pause to consider that often. But I talked already about kind of depression and how that's not a normal part of aging, and we might not associate it with nutrition, but again, often you might, if you're feeling depressed or low, you might not be motivated to cook a meal. We also see a lot of times, with loneliness or grief, we see kind of perhaps a decreased interest in making a meal or taking in calories and good nutrition. And so kind of our emotions sometimes do correlate to what we eat. I know at points in my life I've self-diagnosed myself as an emotional eater. You maybe eat a little too much ice cream when you're feeling blue, but that could also be something to consider for the older adult population as well. Are they kind of overeating, maybe because they're depressed, or maybe they're undereating, getting or malnutrid because they're not taking in nutrients because, again, they're not feeling up to cooking for themselves. Another social factor to consider is income. Often older adults are living on fixed incomes, and this may limit their food budget, causing them to choose maybe lower cost food items, more prepackaged processed foods, which might not be the healthiest option. In some cases, it's really sad, but it is a reality for some that some older adults have to choose between, going to the grocery store or getting their medications. And, not being able to do one or the other have their various implications and can, cause a whole host of issues. Some older adults may also with that limited income need to take advantage of, food pantry programs and that sort of thing. It's those resources that we can help connect them with if needed. Another social factor is restricted diets. I've talked about that a little bit already. If an older adult has a chronic condition and their doctor says to them, you need to cut back on red meat or your salt intake or your carbohydrate intake, that could be overwhelming for an older adult who's been kind of eating the same thing every day for the last so many years. Or maybe after the loss of a spouse who maybe was the primary cook in the household, it might be overwhelming to now all of a sudden be in charge of cooking your own meals. I know in my household, my husband, he's not a great cook, and so I do a lot of the cooking. And, when I go out of town for work, he eats like a frozen pizza or goes out for a meal. And so, think about that in the older adults that you work with, especially after the loss of a primary caregiver or a spouse. How are they going to get nutritious meals going forward? And then there's that companionship, that socialization at mealtime. And I think this is so underrated. Having someone to share in a meal with really helps increase the intake of nutrition. I know, for those that live alone, it might be, hard to cook for one, or it might be hard to, make a more nutritious meal as opposed to defaulting to those prepackaged or kind of convenience items that might not be as nutritious. But if an older adult is able to eat a meal with another person, they're again likely to engage in conversation, which has great benefits in reducing isolation and loneliness, mental cognitive stimulation, and then also again, helping to increase their nutritional intake. And so we have to pay attention to those that have few social connections, maybe those that are widowed who no longer have a spouse, they live alone, maybe they're divorced, maybe their children live far away, or maybe they don't have children, that term solo ager, those that maybe don't have family around. So we need to be aware of those things. I have a few more challenges here. I know I've talked about a lot of them already. Those limitations we've talked about, that lack of mobility, I think really kind of coincides with that next bullet point of grocery shopping. That alone can be a challenge for older adults. Those that don't have mobility issues might have trouble getting to a grocery store, or for even those that can get there, navigating those large grocery stores can be overwhelming. Sometimes I find myself kind of running back and forth. Oh, I forgot something over here, and it sometimes feels like I walk like 3 miles in the grocery store. But for an older adult who maybe lacks mobility or has limited mobility, it can be challenging. And it also might be overwhelming navigating the aisles. Especially maybe, again, think back to somebody who lost their spouse or their partner that traditionally did the cooking. They probably also did the grocery shopping. And so I was working with a gentleman, his wife passed away, and so at our local grocery store, the dietitian did grocery store tours. And so we got him signed up for that. And he was so kind of in awe. He didn't know all of these things that the grocery store had, and it really helped orient him to the grocery store. So I think dietitians within grocery stores are an underutilized resource. They can also help with, those specialty diet plans, recommendations for recipes, and kind of fun and inventive recipe ideas. And some grocery stores even have kind of cooking classes and other things of that sort. We talked about lack of appetite already, and also we've talked about living alone and eating alone. And so again, if you're living alone, you're probably at a higher likelihood of eating alone a lot of the time. And so we need to pay special attention to those that might not have someone to spend a meal with, and find ways to find some companionship at mealtime. Maybe it's through a variety of different options, and we'll talk about those more in just a bit. I do want to talk about, we're going to talk about why companionship is important for senior nutrition. I have some information on this slide already, but I came across a study done, this was a little bit dated, 2015, but I think it had some really interesting findings. It comes from the International Journal of Geriatric Psychiatry, and it looked at a volunteer intervention program. The study used over about 100 people over the age of 60. The older adult participants were divided into 2 groups. So group number 1 received a nutrition guidebook but there was no other component for group 1. So group 2 received the nutritional guidebook and also volunteer visits. And so these volunteers were sent into the home of the older adult in group 2 once a week to help them kind of prepare the meal and eat the meal together. And the results showed that group 2, the intervention group, who had visits from the volunteers, increased in their food enjoyment. Also the self-efficacy, the ability for them to engage in creating nutritious meals, it improved for both groups, which is great, but the group that had the stronger results was that group with the volunteers. The participants also enjoyed the experience, reporting back that they really looked forward to those volunteer visits. So that study just goes to show that food enjoyment, can definitely be linked to that companionship, that socialization, and an increase in nutritious food. So when we talk about companionship at Home Instead, we did our own research a few years ago, and we found that meal companionship decreases feelings of isolation in older adults. And if you think about it, so much of our lives happens around mealtime. Important milestones and holidays, they usually involve some sort of a meal. And even just the day-to-day exchange amongst families or those that live in the same household, they typically occur at mealtime. I remember growing up, every night we would gather around the dinner table and, we'd have conversation. And so as we grow older, especially as we find ourselves living alone, the opportunity to engage in that companionship, it decreases. So how can we find ways to help older adults connect at mealtime, incorporate some companionship at mealtime? And we're going to continue to talk about some of that, but I did want to just share some of the results we found in our Home Instead research. We found that those who ate meals without a companion were 42% more likely to have feelings of loneliness. And that kind of makes sense in my mind. Again, if they're not having someone to share meals with regularly, maybe they're more likely to be living alone. And 75% of lonely seniors, those that express that they were lonely, they weren't receiving the right amount of at least one essential element of nutrition. And on average, those that were lonely received 157 fewer servings of fruits and vegetables per year than those who were not lonely. And they were also twice as likely to have a physical disability that jeopardized their ability to receive proper nutrition. So maybe prevented them from being able to stand up for long periods of time to prepare a meal. And so after we did this survey, we got a little creative and we created this public education campaign called the Companionship Diet. And I know it kind of sounds kitschy, especially with all of the diet crazes that we have in the United States, but it's really more than a health trend. It's a mind shift that offers an older adult a partner, somebody, an accountability partner to help him or her navigate the entire dining experience. So I know people are encouraged to have like a workout buddy to keep them in check when it comes to exercising. And so this companionship diet, the kind of thought behind it is to have an accountability partner or a buddy to engage with over mealtime and the whole process really of shopping for a meal, creating the meal, and then eating and enjoying the meal together. So we have created some tools for this public education campaign, and you can find it at homeinstead.com/companionship-diet. And more of our research, you can see that here on this handout. 19% of those that we surveyed eat most meals with others, while again that 42% ate most meals alone. And then when it comes to skipping meals, some people who don't have anyone to share a meal with are more likely to skip about 22% of their meals per year. We're also seeing eating alone as a growing trend. I know as we become a busier and busier society, 76% feel that they had fewer sit-down meals with family than they used to. And that could be due to a variety of factors. Maybe their social circle is kind of dwindling because they have, family members or friends that are passing away, or maybe their family lives farther away, and so they don't have as many people to share a mealtime with. But at the same time, older adults are really craving that companionship, and 72% said that they wish that they ate more meals with loved ones. So as we went through this research process, it really made me reflect on my own older loved ones and how often I take time to share a meal with them on a weekly or monthly basis. And so perhaps if nothing else you get from this webinar, maybe it causes you to reflect a little bit on the older adults in your lives, in addition to those that you work with in your day-to-day job. But how often are you engaging with your older loved ones at mealtime, and maybe evaluating if we can make more of an effort in this coming new year. Maybe that's part of the New Year's resolution. I know it's going to be for me. But in this campaign that we created, we had some companionship diet tips. You don't have to overthink it. Don't sweat the details. Simply sitting down for a cup of tea or coffee with an older loved one or person that you work with can be beneficial and can help to decrease those feelings of loneliness and isolation. Also, creating a meal plan can be helpful for the older individual. So maybe it's at the beginning of each week or once a month, helping to kind of plan out a couple of meals per week, and then helping to create maybe a grocery list, and then going to the store together, that sort of thing. And then also finding ways to maybe make the cooking process a little more simple. It doesn't have to be gourmet meals that we're talking about, especially for those that are busy, especially family caregivers who are balancing, caring for an older loved one and kids of their own. It can be very overwhelming. So in Instapots, crock pots, sometimes that online delivery can be great options, especially on online delivery for groceries or grocery store pickup can help simplify this process. So a few more tips on this next slide. For some older adults, preparing 3 meals a day could be very overwhelming. Pardon me, I had to take a quick sip of water there. So instead, perhaps it's looking at it a little different and encouraging maybe smaller meals or snacks throughout the day. It kind of depends on the individual, and there's some examples there on the slide. Also, improvising. Sometimes, easy cooking hacks can save us time, and there's so many videos and recipes online. I'm not a TikToker, but I have friends on TikTok that rave about some of the cooking tips that they find on TikTok. And so there's lots of resources that exist out there. And we also can use, it doesn't always have to be fresh. It could be frozen vegetables or canned fruits or vegetables as alternatives. And also creating healthier versions of those comfort foods that the individual really enjoys can also be a great way to kind of improvise. So getting the comfort of those foods and those flavors without some of the calories. But then also not getting too strict. We all, I'm sure, have heard the phrase, life is about balance. It's important, of course, to know what diet is best suited for that individual and maybe the chronic conditions or health issues that they're experiencing, but also we have to live a little. And so if it's finding those alternatives for a sweet treat, that's a great way to still ensure that the individual is enjoying mealtime. And then also we can make mealtime an intergenerational activity and incorporate the older individual in the process of making the meal. And so we can involve them from the very start, from the preparation process. And even if the individual, it has limited mobility, maybe it's involving them in just stirring the items in the bowl together, or peeling the potatoes, something that they can do sitting down, or maybe it's setting the table. The little things that they can do to get involved in the process. Or maybe it's simply sitting there with a cup of tea and kind of giving some pointers and tips as the person cooks. Also creating kind of that positive atmosphere. Maybe you enhance it with some relaxing music or lighting. You could even light a candle to make it special. I know that one professional caregiver that I worked with, she had a client who really had lost interest in eating, but she used to eat out all the time and really enjoyed kind of that atmosphere. So that care professional, she dusted off the tablecloth and got out her good china and lit some candles, and it really sparked this woman's interest in eating again. So sometimes you just have to get creative. But again, it doesn't have to be elaborate. It can be a simple meal, selecting recipes that have a limited number of ingredients, or kind of those meal hacks that I talked about earlier. Maybe it's something you dump into a crock pot and then you enjoy after work with your older loved one. Then finding ways to connect. So I know a lot of families are spread out. They might be long distance from the older adult in their lives, but perhaps it's arranging a phone call over mealtime, and maybe it's making the same recipe on both coasts, but then agreeing on a time to get together and enjoy it over the phone, over a conversation, or maybe it's talking about how did your recipe turn out, that sort of thing. So, or FaceTiming while sharing a meal to continue to keep everyone connected. And then finding times for storytelling. My favorite part about getting together at family gatherings with my older relatives is reminiscing. My grandma, she lived in Europe in her early 20s, and those stories I could listen to over and over. She just had such an interesting experience when she lived overseas. And so, it's those times, again, around a shared meal where those stories can be shared. And you could bring up certain conversations at mealtime or use conversation cards. I know there's a lot of kind of fun games out there that have conversation starters, or bringing out old photo albums, or reminiscing over favorite recipes and foods. And then making, that companionship, that dining together, a more regular occurrence is important. It gives the older adult something to look forward to. So maybe as a family committing to, once a month or once a week. You could also, if it's a larger family, making a calendar of who's going to bring over a meal and when, and kind of creating a schedule. Some of the other fun tips that are incorporated in some of our resources on the website give you some ideas on, ways to kind of make this mealtime fun and exciting. So you could consider a TV night where the topic of the evening conversation over dinner is, your favorite TV shows and movies. Maybe you do a little movie trivia, or decide on a movie that everyone's going to watch after dinner, or watch over the week, and then we can all talk about it at the next time we get together. And then also another idea would be those family recipes. I know every family typically has a favorite recipe that they enjoy. And also for an older adult who maybe, doesn't have a lot of family around, maybe they have a care professional that comes into the home and can help them kind of recreate that meal. And again, we can use those as conversation starters, or maybe it's finding a modified version of those recipes that are maybe a little on the healthier side. But again, kind of creating that conversation and companionship over mealtime. But I know that, many older adults, they don't have family around, or they don't have family that can come over on a regular basis for mealtime. So what are some of the options for those individuals? Maybe it's involving friends and neighbors. Maybe it's engaging them in companionship over mealtime. Pardon me. Or maybe it's a faith community. Maybe they have some sort of volunteer program. I mentioned that grocery stores have delivery services or apps that can help older adults who cannot get to the store. Um, or for those that, pardon me, those that, kind of need those delivery services, if they're kind of on the more low income side, there are often food pantries in communities that do delivery for older adults that need food items delivered to the home. Another option, kind of back to that friends and neighbors example, I have a colleague whose father had Alzheimer's disease, and the mom was the primary caregiver. And family wanted to be involved around mealtime, but it was hard for them to leave the house because his dad would get disoriented, kind of getting out and about. So the family decided to kind of use that shared calendar approach and said, you're welcome to come over and bring a meal, give a couple days heads up. But the rule is that you have to take all of your leftovers with you because the leftovers were kind of overwhelming. And to prevent the dishes piling up, we're going to just use paper plates. Now, it might not be the most eco-friendly, but for that family, they just saw so much engagement from the friends, families, and neighbors coming over, and it really made the stress of having people over a little easier. So again, families can get creative in how they support. Another could be looking into home care services through a professional agency, like Home Instead. A lot of these types of organizations can help with the shopping and the meal preparation and also provide that companionship. I know that there are also volunteer programs through your local area agency on aging, like the Senior Companion Program, programs like that. Again, I mentioned faith communities sometimes have volunteer programs where they can come in and assist. Also, Meals on Wheels. Everyone probably has heard of Meals on Wheels. What a great service in most communities. And Meals on Wheels of America, they have a great kind of search component on their website so you can find your local Meals on Wheels program. A lot of those area agencies on aging also have those programs that deliver meals typically Monday through Friday, and then often have an option for a weekend meal that gets delivered on Fridays in addition. And also just think about the companionship that even that simple delivery provides. I know I volunteer for our local Meals on Wheels, and I love chatting with the older adults as I drop off their meal. Even if it's just a few minutes of conversation, that makes more of an impact than I think we realize when we're able to engage even in just those short encounters. And then also senior centers offer often a congregate meal program. So that can be a great option for some older adults that want to engage with others and want to do that kind of in a group kind of congregate meal setting. Sometimes those centers, though, require you to provide your own transportation, and then others do have transportation that is provided for those kinds of senior centers or senior programs. So reaching out to your local area agency on aging often is a great way to find out about those programs within the community. And then food ordering apps. Who would have thought even just a couple years ago that you could have pretty much anything delivered to your house through an app. So for some older adults, it might be an option. For others that maybe live in smaller communities, maybe not. But it could be an option for some meal delivery every so often, and it could, depending on the individual, might not be right for everyone. But we talked about some of those warning signs. We talked about the importance of companionship. And what if we are noticing that there's maybe an issue, or we want to kind of address this in the older adults that we're supporting or that we're caring for? And I think the first step is really to gain an understanding. Listen, ask about what's happening in that individual's life. Maybe they're recognizing that they're having more challenges cooking for themselves and preparing a meal. And so that opens up the opportunity for a discussion with the older adult and their family about maybe the challenges that they're having. Some people might not want to bring up these issues because they're embarrassed, or maybe they're afraid that if they start to admit that they need more help, that they're going to get moved out of their home immediately. And so sometimes that is a genuine fear that some older adults have. And so they'll, instead of sharing their concerns, they'll kind of try to keep it to themselves and try to overcompensate. So we need to be aware that this could be a sensitive conversation. But that allows the family to, or opens up for a discussion about the issues at hand. And maybe it's something simple like a trip to the doctor, or seeking out a registered dietitian, or going to the dentist. Maybe it's just getting newly fitted dentures or addressing that cavity, and it could make the eating experience more enjoyable. Or maybe you're realizing that arthritis in the hands is making it more challenging for that individual to chop up things. And so maybe there's a few adaptive tools. I have this great chopping tool. I can't probably describe it without showing you a visual. I know you just have my voice, but there are chopping tools that make chopping a lot easier. So if you just, Google or search on Amazon arthritis-friendly tools, and then whatever kind of tool that you're looking for, there's so many options out there. And even for somebody with kind of low vision, there's a low vision center in my community, and had the opportunity to tour there and to work with a few of my clients through that center. And there is a whole host of things that they have that can make cooking more practical for those that are living with low vision. Things like, orange dots on various microwave buttons that are kind of key buttons. I feel like even though my microwave has 20 buttons, I probably touch 3 to 4 of them most days. So, putting an orange dot on those buttons can help someone with low vision kind of know, okay, those are the buttons to touch. So again, there are ways that we can help older adults engage still in meal preparation and that sort of thing. And you may find that it is that kind of loneliness and isolation that is making it less appealing for them to cook just for one person or not to have someone to share a meal with. And then you can kind of talk through all of the options that we've discussed today to see if there are ways that you can help support the individual in finding ways to engage with somebody at mealtime or finding more companionship in that way. And then towards the end of this webinar, I am including just a few kind of nutrition guidelines and food safety kind of tips for those as you are preparing and making meals. I know that myplate.gov has great nutritional guidelines, and they have some that are specific to older adults. But we know, eating more fiber, choosing healthy fats, varying our protein choices, limiting sodium if certain chronic conditions are at play, kind of limiting our sweets and our sugary drinks. Those are all nutritional guidelines that we probably should all be following. And you can find more information, of course, on the USDA's website. And I wanted to just highlight hydration quickly. I know we've been talking about nutrition, but also hydration is a big factor in kind of the well-being of the older adult population. And I know for some older adults, drinking water might be a challenge. My grandma and grandpa will drink like 20 cups of coffee a day and maybe a half a cup of water. They just have not grown up, drinking a lot of water and staying hydrated. And some older adults have, issues with continence or incontinence. And so they don't want to drink a lot because they don't want frequent trips to the bathroom or, accidents throughout the day. So there's some just quick tips here for hydration, kind of enhancing the water, keeping a water bottle nearby. I had a client once, her care professional came up with a kind of fun method of getting enough hydration throughout the day. She had chronic kind of UTIs, and so our goal was to keep her hydrated. And so the care professional bought a box of Dixie cups and would line them up on the counter. And over the course of an hour, she had to take quote unquote shots of water and sip those water until all the cups were gone. And then they kind of celebrated at the end of each of those. So sometimes you have to get creative. Sometimes putting a big old glass of water in front of an older adult and saying you have to drink this might be more overwhelming than a smaller kind of juice-sized glass and refilling that a couple times throughout the morning. So again, we could talk a lot about hydration, but I just wanted to highlight that here. And then also some food safety tips. I know often the expiration dates on a lot of these items are really small. Sometimes I even have trouble finding them on the items. So, for those items that they use frequently, it might be helpful to, put a piece of tape on the item and write the expiration date in a bigger, font with a marker so that they can see that, or have somebody kind of checking regularly for expired items, because we know there's nothing worse than eating something that's expired and having some tummy issues or food poisoning. That can also be harmful for an older adult's health. So I was talking with a dietitian once, and these were some interesting food safety tips that she had said to me, and a few of them I wasn't really aware of, like non-dairy beverages. I thought my almond milk was, good for 3 weeks, but really should be consumed within about 7 days. Reheating leftovers within, 3 days. It's reminding me that I have a few things at home I probably should throw out tonight when I get home. Also deli meat, it's really best used within 3 to 4 days. So again, more of these food safety tips can be found on the USDA's website. But again, just good tips for us to have and be able to pass on to older adults and the families that we work with. And then finally, just wanted to leave us all with some resources. Of course, I mentioned the USDA's website. The National Institute on Aging also has a great healthy eating section of their website with some great tips. I mentioned also, a registered dietitian can be really helpful, especially, for example, if somebody is recently diagnosed with diabetes or other kind of chronic conditions that have implications for their diet. Seeking out a dietitian could be helpful in kind of providing some tips, even just, looking at labels and how to understand labels. I know, some things that we don't think have sugar or sodium in them actually have more, like tomato sauce, spaghetti sauce. Who knew some of those sauces have a lot of sugar or a lot of sodium? And if you go for the less sodium option, sometimes that means there's even more sugar in it. So again, there's so many things to consider. To find a nutritionist or dietitian, you can find kind of a registry at eatright.org. Of course, Meals on Wheels of America is a great resource, as is the Area Agency on Aging for finding congregate meal programs or senior centers. Also, looking into nutrition services and SNAP benefits, they do tend to vary by state, but the website Defeat Malnutrition today/consumers that has some kind of information state by state on those types of programs. And then also when it comes to intergenerational ideas, there's a great website, generationsoverdinner.com, that might be worth checking out and following. Of course, you can find all of the information about our services at homeinstead.com. If you are interested in a care professional that can come into the home and support, whether it's grocery shopping or meal preparation or even just someone to enjoy the meal with, that can be an option for some folks. And then all that companionship diet information, you can find that at homeinstead.com/companionship diet for more information and resources. And of course, you can always reach out to me if you have any questions. There is my email address. But I'm really grateful that you all have taken the time today to learn more about how companionship fits into kind of this senior nutrition conversation. Again, it's not something that we might think is all that important, but when you start to talk with older adults about having someone to share meals with, it really means more than we think it does. So anytime we have the opportunity, personally, professionally, to engage in conversation, especially over a meal with an older loved one or client, it really does go a long way. And so I want to thank you all so much for joining me. I'm going to take a look here at these questions. If you have any questions, feel free to write in, and I'll get to some of your questions now. So some of the people have been asking, will the slides be available? Yes, I think they are available for you on this kind of presenter bridge, and feel free to, use these resources and slides and share them on. Another question: how much fiber should you have in a day? That is a good question. And if you go to the myplate.org, for an older adult, it's recommended to have 25 to 35 grams per day of fiber. So fiber is important, especially for digestion. And so that is a good question. And some people, of course, talk with your medical provider. Having some sort of substitute or supplement for fiber can be helpful. And so, again, check with your healthcare provider or dietitian. Let's see. There was a few other suggestions. Somebody had asked, have you heard of in-home supportive services, IHSS? Thank you so much for writing in that as a resource. There's a in-home supportive services consortium, and so that might be another resource for folks to check out. So thank you for putting that in as well. How can you encourage older adults to apply for nutrition assistance programs? Because sometimes there's a stigma around it. That is a really good question. I think that it kind of depends on the individual, but again, trying to kind of understand their needs and where they're coming from, and perhaps helping them kind of reframe their thought process around a nutrition assistance program could be helpful. So maybe thinking about it a little bit differently, or some programs kind of have kind of sliding scales in terms of like a Meals on Wheels program. Some people, based on their income, qualify for free meals, while some don't qualify, so therefore they have to pay the price for the full meal. So when it comes to the particular programs that you're looking at, maybe there is an option for them to pay just a little bit so they feel like they're contributing to that, and maybe that would reduce the stigma. But if anyone has any other thoughts or suggestions for that question, I would love for you to type that into the chat, because that is a challenging a kind of problem to come up against. And there's a lot of stigma associated with a lot of kind of components of aging and assistance and support. And so really trying to understand, what is that individual's goals and what are their needs, and how can you help to meet those needs can sometimes be a good approach to those various conversations. Oh, I like this suggestion that came in. This individual worked in a memory care center, and she said often they would do a cheers to help everyone take more sips of water. So that is a great suggestion. I love that. There's some, there is some suggestions that are coming in as well. I apologize. It's kind of hard to read and then respond at the same time. There's some questions around, when somebody can maybe no longer cook and have to kind of give that up to somebody, especially if they were the cook in the family. And that can be really hard, if they're having to give up something that they really loved doing. So trying to find small ways to involve them in the process, and it might be as simple as just stirring the batter or reading the ingredients off to the person can help them feel involved in the conversation. So that could be kind of a nice approach and can kind of help them ease into that new role. So I think that's about all the time I have for questions. There were some great suggestions and tips coming in. I appreciate all of you being here today and for joining me in this conversation. And I hope that you'll join us next year as well in our webinar series. Again, we'll kick it off in early February. I believe that all the information is already out on ASA's website, so you can register. But we'll be talking about the ethics of working with older adults, something that we probably all face from time to time in our professional lives, some kind of dilemmas, and even caregivers face those kind of ethical dilemmas. So we'll talk through some ways that we can navigate those ethical decision-making processes. So thank you all again so much, and Victoria, I'll pass it back to you to close things out.
Thank you so much, Lakelyn. That was a wonderful presentation. It has been a pleasure having you today, and we want to thank Home Instead for bringing this webinar to our audience. Thank you all for joining us today. We appreciate your time. If you have any questions about the webinar, please feel free to email ASA at info@asaging.org. You can also go to our website to see upcoming webinars and register for those in advance. If you would like to share today's presentation with anyone, the CEUs are available for a full 60 days. If you watch the recording, you will still be eligible for the next 60 days to receive CEU credit. Thank you again, Lakelyn, and thank you, Home Instead. We hope you will all join us again soon.